What are some tips we have when you go to bed? How do you get to sleep?
I think the first thing you have to look at is just the environment in which you're in. We like the environment to be cool, to be dark.
Why cool?
It helps that downslope of the internal body temperature from warmth into cooling. As you start to fall asleep, you start to become cold-blooded, and it helps you fall asleep and get a little bit deeper in your sleep as well.
I do like a cool room when I go to sleep.
Quiet, and this pertains to the bed partner that you've got snoring next to you. Environmental noise.
Kick them out of the room or take care of their snoring?
Take care of their snoring is probably the best answer. Oftentimes people will end up on the couch or the snorer ends up on the couch.
But certainly that noise keeps people from sleeping.
And this is a big one you don't expect, pets in the bed. I never knew that until going through sleep training.
Tell me about it.
There are a large number of people who actually sleep with their pets.
Sure.
Cats, small dogs and things can be a source of a lot of sleep fragmentation and sleep disruption throughout the night.
Is that right? You said the room should be dark. That seems logical. You go to sleep. Certain times of night we should go to sleep?
Well, it really depends. You don't go to, one of the mainstays of treatment for sleep is you do not go to sleep until you're sleepy. A lot of people think, well, it's say 10:30, it's bedtime, I should just make myself go to sleep, and they're met with frustration, lying in bed, staring at the ceiling, waiting for sleep to come.
How about waking up at the same time?
That's probably the most important thing that people can do to regulate their sleep. Focus less on the bedtime, more on the wake-up time. I want that wake-up time to be consistent across all the days of the week if you're having trouble sleeping.
How about the amount of light that somebody gets? Light has something to do with sleep perception. Does it? Do you want to wake up when it's light, so in the wintertime you can sleep till it's 9? Or where does light come in there in the morning?
For people with what we call a delayed sleep phase, in other words, they can't fall asleep until 3, 4, 5 a.m., these night owls where it goes to an extreme, light becomes crucial because, as you said, your body's internal clock relies on that light cue to help set itself and help tell the body when it's time to wake up and when it's time to go to sleep. And so we'll have patients who are having a lot of trouble getting sleepy at the right time, get that sunlight exposure as soon as they wake up.
Environment at bedtime. How about medications, pain, covers?
So many things can influence sleep. People getting hot flashes, covers being too hot. The medications that they take, antihistamines, blood pressure medications, antidepressants, all known to cause troubles with sleep or insomnia. There are a lot of things you have to look at when people are having troubles falling asleep.
How about taking a bath before you go to bed? Nice warm bath. Does that help people?
I like it, particularly if people have restless legs at night, their body discomfort. Been clinically proven to soothe those symptoms away. Again, you're raising the body temperature up with that warm bath, and as you get out and you start to cool off, that cooling off period, very sleep promoting. So I like to have the bath within about 30 minutes before you get into bed.